Sodium is an essential mineral that our bodies need to function correctly. It plays a crucial role in maintaining fluid balance, transmitting nerve impulses, and supporting muscle contraction. Sodium is a component of sodium chloride, which is the chemical name for what we commonly know as table salt. While our bodies require a small amount of this mineral to survive, the quantities consumed in modern diets far exceed our physiological needs. This excess is a significant public health concern globally. The challenge is not avoiding sodium entirely, but moderating intake to support health rather than harm it. The World Health Organization recommends adults consume less than 2,000 milligrams of sodium per day. This equals about 5 grams of salt, or roughly 1 teaspoon. The American Heart Association suggests no more than 1,500 milligrams per day for most adults. These guidelines are based on extensive evidence linking high sodium to adverse health outcomes. Unfortunately, most populations consistently exceed these limits. A common misconception is that the majority of our sodium intake comes from the salt shaker we use at the dinner table or during cooking. While this discretionary salt use certainly contributes, it represents only a small fraction of the total sodium consumed in many Western diets. The truth is that most of the sodium we eat is already present in the foods we buy. According to the CDC, more than 70% of the sodium consumed by Americans comes from processed foods and restaurant meals. This hidden sodium makes it challenging for individuals to accurately gauge and control their daily intake. These processed foods span a vast range of products, some of which are not even perceived as salty. Items like breads and rolls, cold cuts and cured meats, pizza, poultry products, and canned soups. Even seemingly healthy choices, such as cottage cheese and vegetable juice, can be high in added salt. Food manufacturers use salt not only for flavor, but as a preservative to extend shelf life, as a stabilizer to improve texture, and as a binder to hold ingredients together, making it a ubiquitous additive. A single restaurant meal can sometimes contain more than a full day's recommended amount of sodium. This is true across the spectrum, from fast food chains to sit-down restaurants. In the United States, the average intake is about 3,400 milligrams daily. This widespread overconsumption raises risk for chronic diseases. It's not just individual choice, but a problem rooted in the modern food supply. This number is highlighted in the Global Burden of Disease study. One of the most well-documented and direct consequences of a high-sodium diet is elevated blood pressure, or hypertension. The mechanism is straightforward. When you consume excess sodium, your body holds onto extra water to dilute the sodium in your bloodstream. This increases the total volume of blood circulating through your blood vessels. As the volume of blood increases, so does the pressure against the walls of your arteries. Think of it like turning up the water flow in a garden hose. The pressure inside the hose naturally rises. This effect is not trivial. Over time, sustained high pressure forces the heart to work harder and damages the delicate inner lining of the arteries. Hypertension is often called the silent killer because it typically has no obvious symptoms, yet it quietly and progressively damages the cardiovascular system. The Global Burden of Disease study has consistently identified high dietary sodium as a leading risk factor for elevated systolic blood pressure, which in turn is a major contributor to premature death and disability worldwide. The link between sodium intake and blood pressure is supported by a vast body of scientific research, including numerous clinical trials. Studies have shown that when individuals reduce their sodium intake, their blood pressure tends to fall. This effect is observed across different populations, ages, races, people with normal blood pressure, and people with high blood pressure. While the degree of blood pressure reduction can vary from person to person, a concept known as salt sensitivity, the overall population-level benefit of reducing sodium intake is clear and undisputed. For nutrition students, understanding this physiological connection is paramount. It forms the scientific basis for public health recommendations to lower sodium consumption. The damage caused by high blood pressure does not stop at the artery walls. It sets off a dangerous cascade of events that increases risk for cardiovascular disease. Chronic hypertension is a primary driver of heart disease and stroke. Both are among the leading causes of death globally. When the heart pumps against high pressure for years, the heart muscle can thicken and become stiff, known as ventricular hypertrophy. That makes the heart less efficient and can lead to heart failure. High blood pressure accelerates atherosclerosis. Fatty plaques build up inside arteries. These plaques can rupture and trigger a blood clot that blocks an artery. The WHO says reducing sodium intake is one of the most cost-effective public health interventions to cut these diseases. Sodium intake and high blood pressure also profoundly influence stroke risk. A stroke occurs when blood supply to part of the brain is interrupted or reduced, depriving tissue of oxygen and nutrients. The two types of common strokes are an ischemic stroke, which is caused by a blocked artery in the brain, often by a clot or a plaque, or a hemorrhagic stroke, which is when a weakened brain vessel ruptures, often from high blood pressure. Both types can lead to permanent disability or death. The evidence linking high sodium to these events is robust. Large studies and meta-analyses show populations with higher sodium have higher rates of heart disease and stroke. Lowering sodium intake has been shown to reduce these risks. While the cardiovascular effects of excess sodium are most prominent, the damage extends to other vital organs, including the kidneys. The kidneys are remarkable filters, responsible for balancing fluid levels, regulating electrolytes like sodium, and removing waste products from the blood. A high sodium diet places a significant strain on these organs. To excrete the excess sodium, the kidneys must work harder, which can lead to a gradual decline in kidney function over time, especially in individuals who are already susceptible to kidney problems. Chronic high blood pressure, driven by high sodium intake, is a leading cause of chronic kidney disease. The high pressure damages the small, delicate blood vessels within the kidneys that are essential for filtration. At this stage, the kidneys can no longer function on their own, requiring life-sustaining treatments like dialysis or a kidney transplant. Reducing sodium intake is therefore a critical strategy not only for protecting the heart, but also for preserving long-term kidney health and function. Beyond its impact on the renal system, compelling evidence also links high salt intake to an increased risk of stomach cancer. The World Cancer Research Fund and the American Institute for Cancer Research have concluded that high consumption of salt-containing foods and a high-salt diet are probable causes of this malignancy. The proposed mechanism is that high concentrations of salt can directly damage the lining of the stomach, known as the gastric mucosa. This damage can cause inflammation and make the stomach lining more susceptible to infection by the bacterium Helicobacter pylori, a known carcinogen. This chronic inflammation and cellular damage can promote the development of cancerous cells over many years. Reducing sodium intake may seem daunting, given its prevalence in our food supply, but simple, practical steps can make a big difference. The most impactful strategy: shift away from processed foods and restaurant foods toward whole, unprocessed foods. Cook more meals at home for full control of ingredients. Focus on fruits, vegetables, whole grains, and lean proteins. Diets high in minimally processed, whole foods are low in sodium and high in potassium, which helps blood pressure. Read the nutrition facts label when buying packaged foods. Compare brands of the same product, for example, canned beans, bread, pasta sauce, and choose the lowest sodium per serving. Look for foods labeled low sodium, reduced sodium, no salt added. Checking labels is an empowering skill to develop and teach. Replace salt when cooking with spices like garlic, onion powder, citrus juice, vinegar, black pepper, paprika, and fresh herbs like basil and cilantro. Train your palate to enjoy natural flavors. It can take a few weeks for your taste buds to adjust. Processed foods will start to taste overly salty. Eating more whole, plant-based foods provides more potassium and less sodium, which is part of the path to long-term good health.